Mayo Clinic is extraordinarily lucky to have an extremely strong cardiac surgery program that does provide cutting edge surgical innovation care along many lines and avenues. Hi, I'm Dr. Scott Wright. I've practiced at Mayo Clinic for nearly 30 years as a cardiologist and been here about 36 years, including my training time. I'm joined today by Dr. Juan Crostanello, who's chair of our cardiac surgery program. It was a real honor to basically coordinate and work on this article with Dr. Crostanello.
Hello, my name is Dr. Juan Cristanolo. I am the chair of cardiovascular surgery at the Mayo Clinic in Rochester, Minnesota. I invite you to read in the December issue of the Mayo Clinic Procedure this editorial that highlights our accomplishments, cardiac surgery at Mayo Clinic, a 70th anniversary celebration. In this article, we provide a perspective over the last 70 years of cardiovascular surgery at the Mayo Clinic. Cardiovascular surgery using the Harlang machine started at the Mayo Clinic in March of 1955. Dr. John Kirkland and his team modified the Gibbon IBM cardiopulmonary bypass machine and started a series of operations that revolutionized the practice of cardiovascular surgery and not only revolutionized it, but made it possible.
The article includes an update on traditional surgical techniques, as well as innovations that have literally exploded on the scene in the last 2 decades, including robotic surgical techniques, percutaneous surgical valve replacement, new techniques in cardiopulmonary support or mechanical circulatory support to provide life-saving care for those who are in cardiogenic shock or need cardiac support postoperatively, as well as additional innovations in adult and pediatric congenital surgery.
In 2005, we celebrated 50th years of cardiovascular surgery at Mayo Clinic. Over the last 20 years, cardiovascular surgery has evolved substantially. There has been an emphasis on less and less invasive procedure, either through a robotic approach, through a minimal invasive approach, or through transcatheter approaches. At the same time, there has been a growth in the practice of conventional cardiac surgery, treating patients with increasingly complexity of cardiovascular disease, patients with multiple valvular heart disease, patients with previous reoperations, patients with previous mediastinal radiation, patients with complex congenital heart disease, or with aortic pathology have constituted the basis of our cardiac surgery practice, serving a growing number of patients with complex diseases that cannot be treated elsewhere.
The innovations in cardiac surgery at Mayo Clinic offer patients who travel to any of our Mayo Clinic sites the opportunity to have the most cutting edge and advanced care to restore them to cardiovascular health and to mitigate the illness that they may be facing. Patients who are either facing a second operation or maybe have risks that place them above what's an acceptable risk profile for open surgery will find that there are percutaneous options available.
The education of surgical fellows and residents is an integral part of our mission. And over the last 20 years, more than 200 cardiac surgery residents and fellows from 48 different countries has been trained at our institution. We believe that training the new generation of cardiac surgery is at the core of our mission, as well as generating new knowledge. During the last 20 years, we have published more than 3,000 peer-reviewed articles that have defined the way the specialty move forward.
Research will continue and innovation will continue for traditional open heart surgery, including trying to make it less risky and safer for older adults as Americans age. But we're also going to see new innovations in minimally invasive surgery, robotic surgery, and percutaneous surgery. The most likely area of explosive growth, in my view, over the next decade will be the availability of percutaneous valve replacement options for any of the four major cardiac valves. Patients can also have and will find further research in robotic surgery. Robotic surgery has really reduced the morbidity of surgery, the length of stay for surgical care, and the quickness of returning to work or full health. And I have patients coming weekly to our valve clinic where I see them asking for robotic and minimally invasive surgical procedures.
We have developed a unique practice in minimally invasive mitral valve surgery, surgery for hypertrophic cardiomyopathy, surgery for complex aortic disease, and surgery for tricuspid valve diseases, and surgery for pericardial diseases. At the same time, our heart and lung transplant program has continued to grow, and over the last 5 years, we have tripled the number of heart and lung transplantations.
I think you'll find the article quite fascinating, and I encourage you to read it to understand more about what's happening at Mayo, including a peek at the number of procedures we do, as well as the growth that we've seen in all of the areas that we've talked about in this interview. The data are best contained in the article, and I encourage you to read it and write us and tell us what more you would like to hear about cardiac surgery at Mayo Clinic. And for those of you who are adept at social media, we welcome you to tweet about the article, and you may certainly copy me at Scott Wright, MD, or do it on TikTok or Instagram or LinkedIn. All of those venues, I think, help spread the word about cardiac surgery innovations at Mayo Clinic.
Thank you for listening.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.